Hey, greetings and more greetings to all of you returning to us. I'm truly glad that you found us today, and well, every other time you caught us live. So, let's talk about the topic tonight. The topic tonight is a little different than our usual candlelight romance. Usually, we steer clear of technical topics. We let other people handle that because they have a far better handle on some of the technical stuff than I do. So instead, we talk about the roles and job hunting and roles and things like that. But tonight, we're going to talk about coding resources, self education, and research. So, as a coder, we all know that it's important to have a firm understanding of diseases, billing, treatments, laws, anatomy, and even language. So, making sure you have access to accurate, detailed information is extremely critical to being successful. And if you've seen, there's tons and tons of information websites and media floating around the interwebs. Oh, we got somebody else joining us today. We have Mr. Glenn Krause here. So, there's a lot of information floating around, and it's important to find the information that you need quickly. So tonight we have three panelists meant to cover the mobile angles of this overwhelming information we have here. First one is Sanal Patel. So Sanal Patel is a compliance consultant and actual podcast host for the Paint the Medical Picture podcast and CEO of SP Collaborative. I think SP stands for like super potential collaborative. And to the website, spcollaborative.net. And next we have Beth Sleeper. So Beth Sleeper is the owner and instructor at Advanced Coding Services, www.advancedcodingservices.com. And she offers a lot of on-site education. So not so much the online, but she does offer a lot of on-site. But you will see her around on chats. And lastly, we have Mr. Glenn Krause, who is the... Oh, is he there?
Yep.
Yes, he's here in voice. He's one of those ethereal people. So the creator and co-founder...
Hold on. Go ahead. I'll put my camera on.
All right. The creator and co-founder of Core CDI and the co-founder of the Top Gun Audit School, www.corecdi.com. And there he is. So tonight, we're going to talk about some of the topics and information that's out there. So let's just dive right into it, shall we? So let's start at the beginning. Let's just start with the biggest topic of all. In each of your opinions, what is the primary source of information that any coder should go to first? You know, what's the mother lode and the most important resource that a coder can go to, other than their books and Encyclopedia Britannica and those kind of things? What are some good informational sources that are specific to coding? Let's start with Sanal.
That's a great question, John. I started in the industry a minute ago, right? And at that time, we really only had, like you said, the textbooks, right? That whichever program you went through, I was lucky enough to go through a HEMA-backed school. And so all of my textbooks that I still have in the basement, covered in cobwebs, are from HEMA, and their workbooks and, all authoritative resources. So, outside of that, fast forward, the people who are trying to, burst into the industry today, I think are really, really lucky, right? Because they're afforded much more trusted resources if they know where to look. There are trusted resources we have right here on this panel of people who I've worked with for quite some time. I trust the work that they do, the research that they perform, and then produce, publish, podcast, YouTube, their work. So I think it's a really good opportunity that we have in the landscape today to make sure you know how to network, make sure you're networking with people who are established, who can help guide you to, current weekly podcasts that go on that talk about compliance, regulations, how to make sure that you're, coding correctly the first time. So we don't have the mayhem that I see in the work I do on the back end. So, that's where I would look to, outside of the textbook, outside of the AAPC blogs, the AHIMA, classes and things like that you can take. There are many other opportunities for really outstanding podcasts, LinkedIn Live broadcasts that go on. It's a really enriching opportunity, in my opinion.
Let's go to Glenn. Glenn, we haven't heard from you yet. So what's your go-to for any coding resource?
Well, I want to take Sonia, that was good. Let me kind of give a different perspective. A lot of what I see for coding, well, I'm trying to see how I want to say this. Okay, so a lot of the coding, I think deficits and knowledge base go back to the clinical portion of medicine and understanding the disease processes and the relationship between the two, different 2 or 3, because a lot of patients come in with concomitant conditions, and of course, if you're talking about inpatient principal diagnosis, and when you're talking about outpatient, you still want to be able to validate the diagnosis, right? Particularly with medical decision making and the number and complexity of problems addressed, whether it's inpatient or outpatient, E&M. So I feel strongly that if from a coding education perspective, all coders, whether you're inpatient and outpatient, should be really focusing on expanding their clinical knowledge. And some of my sources are the New England Journal of Medicine. I pay for it, but for the it's like, I don't know, $120 a month. But it's nice because they have cases of the week. You can sign up for free. Doesn't cost you a dime. So and a lot of I think what coders should be doing should be self-directed. Like, for instance, listservs. Are you on the CMS listserv, right? Sometimes you see things. Are you definitely on your Medicare Administrative Contractor listserv? Because sometimes they'll say, hey, they put out reminders as part of their medical education, or reminders about this, or this documentation requires this, or we're seeing this. And so is it directly coding? Maybe not, but it's certainly important to coding. When you talk about coding, you talk about LCDs and NCDs, and you particularly for incision and I&D of abscess. I'm working with an ER medical director to come up with a template for documenting the I&D of abscess. And one of the things that they didn't come to mind on their end is that there's specific covered diagnosis. So you can have the best documentation, but not get paid for the particular service. Or if you're coding ERs from an NCD lab, 23 labs, one of the biggest lab denials in most ERs is BNPs. Anybody come with a shortness of breath, we order a BNP. And so people say, well, it's only $3 reimbursement, but add up how many times that happens. So I really think that when we talk about coding education, I stress to myself and to others in the field, don't just limit yourself to the coding clinic and blogs from the AAPC and AHIMA. Think globally and say, what is important to coding? It's the clinical knowledge. So that's really what I think, John.
Okay, good answer. I mean, that's one of the foundations. If you don't understand clinical, it's almost near impossible code. Beth, in the upper right, what's your take on this?
So kind of a little of both of those. My go-to is always the source, and that's kind of counterintuitive. But if I'm coding a Medicare patient, I'm going to go to CMS. I'm going to look for those MLNs. I'm going to look for those NCDs, the LCDs. Right. How do they apply to this particular patient or this particular case? If I'm looking at, when I wanted to become an auditor, I found the trusted source, and I say trusted because I don't know if we're naming names, but I found the trusted source, and I took some classes from them, and they are in fact the trusted source. Nameless. but it's a lot of research on our own of where to find them.
That's right.
Trust but verify. Sunal, and I love Sunal, and Glenn, it's nice to meet you, but you have to weed out your friends. I have some great friends, and they're coders. They may or may not really know what they're doing.
Yeah, don't you love, Beth, and when you would look at somebody's listservs and someone gives an answer and I say, "What? Are you crazy or
Where
something?"
did that answer come from?
Yeah, where did that answer? I wanted to say, "What? Are you nuts or something?" But I get thrown off listservs, so I don't say anything anymore.
Well, and you look at their answer, and then you look at their signature line, and you're like, "Wait, you are a certified coder? Okay, well."
Well, they're good at test taking. That's about it.
Yes. So for me, it's always, I trust but verify. And Glenn, if I'm going to ask you for some information, then I would appreciate that documentation to support where you found it. So I have learned for the next time. So the next time somebody asks me,
I always do, and I'm sure Sunil does at the same time.
That's right.
If someone says, "Hey, what are your thoughts on this?" I always give them my citing source. So I'd say, this may not apply in this situation, but this is what I would do.
Right.
Here's the coding clinic. Here's a CPT assistant. Of course, every case is unique. It's not cookie cutter. So unfortunately, you can't take something. But of course, what our lovely auditors on the payer side, they pick and choose what they want and what they think is important and interpret it the way they want to.
Right. Yeah. So I go to CMS, I go to the sources, AMA, the Medical Association. I do their symposiums every year to learn their thought process behind the new codes or the changes to the codes. Always looking at your payers, looking to see what their new guidance is or how they're specifically using codes. So those are kind of my go-tos. Of course, I reach out to friends, and maybe they'll give me hey, you might want to check Blue Cross. And so we check Blue Cross and see. But those are kind of some of my starting points.
All right. So let's try this new question. So what is each of your favorite medium for learning coding? I mean, like audiobooks, websites, like what works best for you and why is that?
So I'm just gonna jump in. I like the websites because they're date and time stamped. And so I can download a new payer guidance, or I can download a newsletter, or whatever, and I can date and timestamp it and save it in my file. So I like those websites because they're immediate. I can check it today. What does it mean for right now? And get my answer, but then also keep that as a reference for the next time.
All
right. How about you, Glenn? Let's work backwards.
I agree with Beth's viewpoints. If I'm trying to explain a disease process that factors into either inpatient or outpatient coding, and what the doctor translate the actual documentation into a diagnosis, I always have a reference, whether it's up-to-date website or the New England Journal or a Mayo Clinic, something that has clout, has name recognition, and is trustworthy. I certainly don't go to the Merck's manual because that's kind of a layman's term. So I agree with Beth. Something that has that's well known, that people recognize, that you can point to. It's not related to an opinion. It's a statement of fact.
All right. How about you, Sunal? What's your favorite medium for learning coding?
I think I agree with what everyone has said so far. I prefer the websites as well. I like to file away things that are dated, time-stamped each quarter from all the payers. I keep files of all that kind of stuff, right? And then when I'm talking to a client, I like to provide current resources to them, right? Especially if they are contracted with that particular payer. But always reading in JAMA, all sorts of places where you can find great information. FDA websites, obviously the CMS websites,
It makes for great bedtime reading, doesn't it?
It does. It does.
You know what I hate the most? This happened to you, ladies. It's like about 11 o'clock at night, and then you say, well, let me read one more article, and then you then it links to another one.
Yep.
Before you notice, like 12:30, I got to get
It's
up at 5 to
12:31
catch a
o'clock.
plane.
Yep.
I better get some sleep.
And you've
Yep.
completely gone down the rabbit hole. And before
Yeah.
you know it, you've read the entire Federal Register.
Yeah, well, I wouldn't say that. That I can't do in one reading. No, I got to go out to the gym or go skiing or something.
No, I've gone down a rabbit hole where you read one reference, next thing you know, you've read the entire NCCI manual and highlighted all the key points. Yeah,
That's what we call focus, John.
Yeah.
So we did touch on websites, but what are some other good sources that are out there that, if you're not a reader or if you don't have the internet access, what are some other options for people where they can learn stuff or they can take in information, like other kind of reputable sources or any kind of other sources that are out there, whether it be podcasts, video recordings, or
I can start. Let me take a stab at that if you don't mind.
Sure.
There are podcasts like myself and Sonal does podcasts, but if you're not a internet person, you can certainly read the paper copies of the New England Journal, JAMA, Health and Hospital News, Modern Healthcare magazine. So there's a lot of paper, but I still get some paper journals and so forth, so I have something to read when I'm waiting for my delayed flight at the airport. But most of but even I think if you really are serious, certainly if you're serious about education, you have to mirror and be cognizant and want to read things on the internet, because 20 years ago was all paper. Now it's basically everything, even like newspapers. Some newspapers aren't even in paper anymore. So you gotta be up to the times, I think.
Yeah.
all right, so Beth.
I was going to say, Sonal's podcast is amazing. And
3 years. She's been doing it for 3 years, right?
I know, right?
3
And she's absolutely amazing. But she's also started the Compliance Capers on Fridays, which are great fun, and they're great to listen to with her and Betty. Just how they play off each other, but it's educational, and you're learning what has happened to other providers or other practices, so that you can see warning signs if you're starting to see those signs or symptoms, right, in your own practice, or a practice that you know of. And so it's educational, but they're also fun to listen to.
Well, thanks, Beth. Yeah, thank you. So absolutely, like I said, when I first started answering question number 1, today's times have totally changed, right? And I think it really is imperative that you have access to the internet. As a certified coder, as somebody who's trying to become a certified person, it's really imperative that you have broadband access, right? Because a lot of these really instrumental publications, like Glenn was hinting at, are no longer on paper, right? They're all going to come to your inbox in the email, right? So things are going to be more, their footprint is going to be on the World Wide Web. So I think that's a must. In terms of podcasts and broadcasts, there are ones that are fun and entertaining that have also had a footprint, like on YouTube, and it's much more of a visual thing. But in terms of really, really good education, foundational education that literally comes from the news, like from the medical economics, from healthcare finance news, modern healthcare, Becker's, all of those types of things you can get on multiple podcasts, right? Like your MGMA has a great podcast. There is the AHLA. It's an attorney's podcast. Fantastic. I think the AAPC still has a podcast. I'm not certain if it's up to date. I forgot. But I think they had one. So there are definitely lots of places where you can get, concrete, informative places where you can find really, really different ways of gaining more education in your day. You're
You
taking
know,
a break, you're taking a walk outside. You can put your headphones in and hear a podcast. It's really,
if you're at the gym where I just came back from, you can
yeah,
hear a podcast while you're puffing and puffing on the elliptical machine.
that's right. Yeah. So education is key. And I think we've said that time and time again, separately here in our careers, that continuing education for a coder, whether it's inpatient or outpatient space, it doesn't matter. You have to keep up with it.
Yeah,
You
there's a
know,
reason why.
and one thing, John, if I may say, uh, if you want to be, if you're truly vested in your profession, and you earned your CPC or one of the designations, and you have to you require to uh, achieve what CEUs, a certain number of CEUs. I'm not familiar with the AAPC as much as a HEMA. Uh, it's not enough just to get your minimum number to get by. You have to say, okay, sometimes I have 3 times the amount of what's required. Why? Because that's the way I am. If you want to be advance your profession, or you want to stay up to date, which you must, if you want to make a difference and contribution to your employer, you have to know more than just the minimum amount to get by. It's like writing it's like writing a term paper. You remember in college doing term papers? I loved writing them. I'd ask, when are they going to get started? People look like me, I'm crazy. Okay. But the reality is I love writing them. And it's the same thing. You have some people who do their term paper 2 days before and get a C and they're happy. Well, I'm not happy with a C. I'm happy with doing the research and becoming more proficient in the topic that I'm writing about. So it's the same thing with coding. Coding is a profession. What you put in is what you get out of it.
That's right.
Absolutely.
There is a reason why we're mandated to get CEUs, because you can't just, take the test and that's it. You need to keep and upkeep and upkeep and upkeep.
Right.
So we talked about some of the different avenues of education and self-teaching. What are some of the pitfalls? Like, what are some of these approaches that when you take them, you have to be kind of cognizant of, like what are the downsides? Like when you're learning anatomy, that's not something you can just hear. You may be visual. So what are some of the other approaches that anybody that wants to learn is going to have to take into account before they take that step?
Beth, you go first.
I'm like, I'm trying to think.
Push it on bench.
Repeat that question, will you, John?
So when you're taking it,
calling Beth.
when there's other approaches, there's always pros and cons. But
Yes.
what should you be aware of before you say, I only want to listen to podcasts, or I only want to do websites, or
no.
No, you have to have a holistic. Go. You go.
Yeah, no. We're not advising that you should just tune in to each and every podcast. No. Education starts first and foremost with whatever your educational body is, right? Whatever that community college is offering it, whoever is teaching it, right? They're going to be providing you with those textbooks, those workbooks, etc. So that to me is first and foremost, right? Because those are the people that will provide you with the extra places that you go to for the anatomy, right? The what's that book? Netters is this amazing, right? So like that is foundational. So that you should definitely pick up, obtain it. But those types of institutions, places are going to provide you those extra steps of what you do outside of the classroom, right? And then to supplement your education to, really provide you with that extra support. Mm-hmm. In today's times, I think people are lucky enough to have established professionals going out above and beyond, trying to help the entire community with their podcasts, right? Talking more on the side of CDI, more on the side of compliance, right? All of those things might not necessarily be implemented in the classroom in that first couple of months of your education, right? That's what I've learned. Nobody ever taught me compliance when I first started my education back in 2008, 2009. They did not.
And one thing to know, I think you can agree. People think if they go to a boot camp, and we know what companies offer boot camps, and Beth is going shaking her head. Look, what the heck, right?
No.
They think that boot camp you can learn. No, that just gives you the fundamentals.
Right.
And I just want to say, like I said earlier, coding is one of those professions. The more you put into it, the more you get out of it.
That's
And
right.
I started out in coding back in 1993, $9.98 an hour. Sounds like a Walmart special, doesn't it? $9.98 with what's that little
The smiley face.
smiley face going down, price is going down. Okay. And I decided I didn't want to make $9.98 an hour for more than a year. So I spent a lot of time going to the medical school library after work.
Mhm.
Why? Because I didn't have a lot of jingle in my pocket and it was free. Okay. So
Yes.
I never went to any formal coding school. I took one of those coding classes in my RHIA. They teach you how to look up hypertension and heart failure. Then when you see a record, you say, I'm lost. I don't know. We better call Beth, right? So it's really, I think, no specific medium. It's just that you need to plot a course and say, this is what I'm going to do. Here's where I am. Here's where I want to be. And at the beginning of the year, put a game plan in place. Almost like, what do you call it, a New Year's resolution? But it's not a resolution. It's a specific game plan that you're committed to. I always say, set your goals in the new year, and the goal is a dream with a deadline. Okay, you say by the end of the year, I want to be this. I want to learn this. I want to. If I'm doing easy cases in the office, maybe I want to do ambulatory surgeries. Okay, how do I get the knowledge to go from here to here? Maybe I'm sick of doing POCTs, POLs in the office labs. Maybe I want to code, let's say I'm in a surgery center, I want to do gastroscopies. Okay, fine. Then after that, I'm going to do maybe orthopedics. So it's really, I think, in my mind, putting a game plan in place and determining how I'm going to go from A to B, just like a MapQuest or whatever. And then decide, am I going to read articles to what deficits do I have? Is it clinical medicine? Is it the coding rules? How do I bone up about orthopedic procedures? Well, no one's going to feed you. You got to look them up and read on them on the internet.
So I'm going to take a little different approach to this. I mean, all of that was great, but when I have a new student come into my classroom or online, the first thing I ask, one of the first things I ask is, do you know your learning style?
Because that's a good
That's
question.
nice.
We
Yeah,
all
that's
learn
nice.
different.
That's nice.
We all learn different. And so in my class, I mean, we use the APC curriculum. So there's a lot of reading, but we also watch videos and we listen to lectures and we write notes. And so we're trying to capture everybody's learning style because they're all different. So I might talk to you about the anatomy of the heart, but if you're a visual learner, you see that on a video. We play on the big screen and you see a video of the heart and the blood flowing. Suddenly it makes more sense than just reading the words on the page. And so there are all kinds of mediums. There's podcasts, there's YouTube videos, there's books and magazines and articles. So there's ways that everybody can learn. If you're a visual, I'm a very visual person. I can learn by listening, but I'll be very honest. Sometimes I listen and I just get distracted. Red bouncy ball. And so it's important to know your learning style.
That's excellent, Beth.
You're going to learn the most, the best, that you're going to actually remember and comprehend and understand that. So
and I can see you do a lot. You do a lot of reading because look, you got books in the back. See,
I have a lot of books in the back.
That's right. And you got picture in front of you to keep you entertained.
I do.
You see that on the wall right there? Who's that?
Who's that?
Yeah.
You don't know who that is?
No, because it's sideways.
Oh, well, it's on the side of my wall, but that's a an artist rendering of Jesus.
Oh, okay. That keeps you going, right, Beth?
He keeps me entertained.
So there was a comment made about the cost, about doing things that are free. So let's talk about when there's free education and there is education you have to pay for. Like, what are the pros and cons of free education versus pay education?
Can I take this one first? Okay.
Yeah.
Go ahead, Beth. You're number one.
So you going back to what Glenn said, you get out what you put into it. So if you're just surfing for free education, you just want those free CEUs, that's all you're going to get. But if you're intentional and you want to grow yourself personally and professionally, you're going to have to sink and invest some money into yourself. How much do you want to grow? How much do you value your career and your growth in that career, your profession? So yeah, you might have to pay for some things. It's going to happen. It's just life. When you go to school, you pay for that. Everybody who went to university, who went to trade school, vocational school, it doesn't matter. You had to pay for that. CEUs, I mean, you can get them free, a dime a dozen, to attend any chapter meeting, and you'll have CEUs. But the ones that you have to pay for, those are the ones where you got some skin in the game.
And Beth, some of them that you pay for, you got to be very selective because some that
Absolutely.
you like. AHEMA was going to require that the members who have certifications have to buy 40% of their educational material from AHEMA. Well,
Right.
I hate to say this, but I'm going to say it. I'm probably going to get a lot of hate mail. But some of their presentations are just rehash the same old thing with a new title. So be very
Yeah.
selective. When you're paying for something,
Yeah.
you have to be selective. Just like when you pay for a movie. I went to a movie over the weekend. I don't even remember the name. It was so bad. Uh, I said, "Oh, $12 for a movie is going to be good." And it wasn't worth nothing. So you gotta really look at the description of of a webinar or whatever you're attending to say, okay, what look on the internet, see if there's any been feedback from the presenters or the organization, because you certainly don't want to throw your hard-earned money away
Right.
buying something that yes you get a certificate, but it has it helped you. That's the bottom line.
Right.
Has it helped you?
Yeah, I agree. You can get CEUs anywhere. The pandemic changed everything, right? And the whole model of getting those CEUs now, anybody can go and obtain them from a chapter meeting and they're free. But like you said, Beth, I agree with you. It's a matter of, are you just collecting them? Are you just hoarding them to meet your requirements to renew up at the end of your 2 years? I would think not. When you decide to, look deeper into, I don't know, specific people who are teaching a course and you obtain CEUs, is it for your specialty? Are they really, really known for that particular niche? Cardiology, compliance, CDI, what? Right? You really have to, I think we've all said the same thing, is that you really have to invest in yourself and know what you're worth, right? Like, you don't just want to stay in the same position in your career
Oh no,
for the
not me.
next 5 years. You want to keep escalating. You have
5 years?
to
I
keep,
only want 2 more years.
right.
I want to
So
retire.
you want to retire. Well,
That's my plan. I got a game plan, but I'm still learning. That's the thing. I
exactly.
mean, people ask me, why are you posting things on LinkedIn at 2 o'clock in the morning? I say, because I came up with an idea and got out of bed and put it in there. So be very, Sanal is right. Invest in yourself. See if that webinar or presentation or in person uh, 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 meeting is it gonna well, what are you gonna get out of it? What is the content? And if it doesn't meet your needs in terms of growing your career, if not, don't go. Just
Right.
not just because you got a CEU. Okay, fine. You can do that on. You can do that at home. Just invest your time wisely. I think that's a good summary, right? Invest your time and your money
Right.
wisely.
Well, so no, you were saying before about that you. I'm sorry. What did I say? Go on, Sonal. I lost my train of thought.
Don't you
Yeah.
hate that?
So
Don't you hate that, John? When you lose your train of thought.
exactly. Well, in a panel situation, that kind of happens, right? But
Yeah.
no, I was just trying to say that I think it's really important that we invest in ourselves, right? You have to be able to escalate your career, advance it from a different organization, right? You can start working on your own. You can try out your hand at your own company. There's so many things that you can do in today's times. And if you are a coder, I really do believe that it's in you, this kind of craving, this hunger for knowledge that really doesn't just stop because you gained a credential or two. You have to keep going. Yeah.
And don't you think, ladies, that there's far too many people who have that mentality? Not everyone, but I'm coming across people that are saying, you know, November or December 15th. Someone puts on LinkedIn. Anybody know where I can get some quick CEUs? But when do they
Yeah.
do?
For free.
December
Well,
31st.
I
Yeah,
see
for
that.
free. Yeah.
I
Well,
see that every day. I
yeah,
see that
I've
every
seen that.
day.
December 15th, they put down John
Yeah.
on LinkedIn.
Yeah.
Anybody know quick? Anybody know where I can get some quick CEUs for
Yeah.
free? I put on there, well, how many you need? 30. When did you know? About 2 years ago. It's like,
Mhm.
okay, obviously that person is just gaining the CEU so they can say, I did it.
Yeah.
Yeah.
Yeah. There are a few of those people. And I think we know where to go if we really are desperate to get that one or two couple of CEUs. It's hard to help a few of those folks that are really strapped, right? And they didn't keep up over these past 2 years and maintain their continuing education. That's rather difficult.
And
How to help people like that.
it really shows their commitment to the profession when they wait to the last minute. Hey, Beth, whenever people get short of CEUs, I'll just send them your way. Okay?
Okay. Thanks.
Yep.
So for those people that are constantly looking for CEUs, what is the best way to find these kind of CEUs or these resources? Like, how do you search for them? If they have to, if they're in a pinch, like, what's the best way to find accurate and appropriate information?
Well, you just look on our AAPC magazine, and you just take that quiz at each and every magazine, and you can obtain your CEUs there. I believe you get one for each
Yep.
for each magazine.
Yeah.
Is that right, Beth?
I can't remember if it's one or half a one.
I think it's one. So you should be able to afford
magazine.
yourself 12 in the year.
Yes.
Right?
And a HEMA has some too.
And AHEMA has some too.
Yeah,
you
that's
see?
right.
And I think you can get quite a few from our Macs as well. If you search their pages on their education, they have a webinar or one or two.
Yeah, if you're on the Max website, yeah.
Yeah.
I just had one there. There's one coming up on the E&M pitfalls for established patients. Well, one CEU. I'm getting something out of it because I want to know what is First Coast Service Options finding in their region with their targeted probe and educate subsequent visits or established visits in the office. Well, then I can go to my clients and say, don't do this, or be careful about this, or I'm seeing this out in the Southeast. You're in the Northwest. Be very careful because if it's happening in the Southeast, it's happening in the Northwest.
So for me, Advanced Coding Services, I'm going to do a couple shameless plugs here. Sorry, guys.
That's okay. Go for it.
We have a membership where you can join the membership and get up to 48 CEUs every year just by listening to our weekly webinars. They're all we get APC CEUs. So that's a way for people to get them. But for me, I am a member of AMBA. And sorry if I'm naming
Yes,
some names,
same.
but I'm a member of AMBA,
Same.
and that's where I get a lot of my billing.
Who's Amber?
American Medical Billing
American
Association.
Medical Billing Association.
Oh, why didn't I
Fantastic.
know that?
Fantastic organization.
Fantastic. So that's where I get some of my billing, because I have a CPB. So I get some of my billing CEUs from there. I have a CPMA and my CPCO. So I go to NamUs to get
Yep.
my CEUs from there.
Same.
So
Yep.
like I have all of these credentials, and I have the sources myself where I could get them. I could get them from myself with our memberships and our retreats, but I don't. I get them outside of myself. I think that that's better ethically. But I also think that then I'm expanding my own knowledge. I'm not just getting them from what I already knew or from a class I taught or from somebody who taught me something. I go to my chapter, I go to my chapters, I go to different conferences and such to get my personal CEUs.
Yep, exactly. I go to those same places. Just become an active member with these organizations, and you can also receive your education from them once or twice a month. Like clockwork, they put up a schedule. I'm speaking for Beth in a few weeks at her organization for her membership. Yeah. So, there are lots of places you can go and get your continuing education.
And if you're a HEMA member, and if you do a presentation to a group, like your own state or chapter CMSA, or you do I'll do one for Actus. Okay, well, I'm still presenting and it has relevance to CDIP. Well, you get 1 credit for that. So you do the homework, you do the presentation, then you present it. You get one. I get a lot of my CEUs because a lot of people ask me, hey, would you speak to my chapter AAPC in Florida? Say, why not?
That's right. That's another great point, Glenn, is if you want to be
doing research, you're learning something. Go ahead, Sonal.
Oh, sorry. I was just saying that's a great point, Glenn. If you want to be, known for something, you can definitely present at your chapters. You can present your own material and receive CEUs that way, just for doing the work, right? Presenting at your organization. I know we've done that time and time again, and you can get CEUs just like that. There's so many different ways.
Right.
Yeah.
So I know Sonal, you have something going on you have some collaborative going on this afternoon. I think it's wasn't that with St. Patrick?
That's right.
SP. That's the SP. You were doing something for St. Patrick's Day. You had to roll out. So Sonal is going to talk a little bit about her own resource that she offers, and then she's going to leave us today. And
then I'm going to leave. Yeah, I'm so sorry. But yes, I've got to go away for St. Patrick's Day in downtown. So, but anyway, my own resources, definitely. You guys can definitely check me out, subscribe, follow me on Paint the Medical Picture podcast. It's my 3rd year. I can't believe it. And then don't forget, on Fridays, you guys can always attend a LinkedIn Live broadcast that literally just started in the new year with my good friend Betty Hovey. And we do something called Compliance Capers, which is all about doing the right thing, staying compliant. And we curate each and every month on a specific topic. The month of January, you guys can go back and look on my YouTube channel for Paint the Medical Picture. They're all housed there. The month of January was all dedicated to enforcement actions. The month of Feb was devoted to advisory opinions by the OIG. And this month is very exciting. And we are focused on the OIG work plan and how our providers, even ourselves, should be using the work plans to understand what is going on, what's in the spotlight. So, yeah.
Sounds
more
like
great resources.
Looking forward to that.
Thanks, you guys.
See ya.
Bye.
Have a good one.
Everybody. We're still going to broadcast. We're just without Sonal. So now we're down to Beth and Glenn. So let's talk about a few more quick topics. So
and then there were 2.
Yes, and then there were two or possibly three.
Yeah, good one, Beth. Good one.
So we have gone in the past from the on-site education as the only option to now near virtually all virtual. So what are the pros and cons of an on-site education versus taking only things on the interweb?
Beth, can I start out with that if you don't mind?
Yeah, go ahead.
I used to do a lot of on site, and I unfortunately, and I say this with conviction, is that okay when you're doing remote, there's always a tendency to do something else, multitask, right? When you're on site, you're sitting there focusing unless uh, uh, you may not be paying attention, but you're there. I always get more questions when I'm on
Mhm.
site. Okay, I like to have fun when I'm presenting, so I might call on someone and say, "What are your thoughts?" and say, "What's your name?" Or you don't have a name tag, then I ask, what's your opinion? Or and I can see body language, and I can say,
Yeah,
okay, I need to adjust my presentation. If it's right after lunch, you got to be high pitched because people are digesting their food. When you're I can learn either way myself personally because I stay focused. But from the standpoint of other people, in my personal experience, seeing them in person, there tends to be, I think, a better there's better attention being paid. People are more focused, uh, as opposed to it's almost like a lecture. Beth, would you agree? When I'm doing a presentation, I mean, you can ask poll questions online, okay, but people are not talking. I mean, you can use the chat box, okay, but it's not the same thing as
yeah.
being on site. But on the other hand, uh, I've seen organizations, particularly HEMA chapter in Southern New England, state chapter, they had their annual meeting first time, a couple, was it last year after the pandemic, and they only had 40 people who showed up for their annual meeting. So,
Hmm.
and I have to say, half of those were vendors. Okay, it was pretty sad. And Beth's shaking her head, like, yeah. So, I think we are in the realms of remote presentations and learnings. Uh, if you're committed to your profession, you will seek those out no matter what they are, and take advantage of that. Beth, your thoughts?
I think all of that is true. I would say that I think that in person definitely generates more spontaneous
It
conversation.
does.
I mean, there was three of us. A second ago, there was four of us, but I could not have a sidebar conversation with John or with you, Glenn, while Sonal was talking because there's only one speaker. There's only one microphone, and so only one of us can talk at a time, which is fine. I mean, we have manners, but if we were in a classroom setting, um, John could be teaching and I could be having a side conversation with Sonal. Like there just is more spontaneous conversation. There's definitely more interaction and more questions that get asked
That's right.
in person as opposed to the online
You
setting.
can have a breakout. I mean, I've been a presentation for the Western Tennessee HEMA chapter, and we've had when I'm on site, we have okay, we have our breakout sessions. Okay, this half of the room discussed this case. This half of the room discussed this case, and then we had someone come up to the microphone and discuss the case as part of the group. Okay, you can't do that. It's hard to do that
Yeah,
on a Zoom. You can have breakout rooms, but it's not the same thing as being in person.
that's right. Because you're not well, and you think about it. I mean, I'm guessing we've all been to HealthCon or regionals, but we're all in the same class. And then we leave and there's just those conversations that happen in the hallway.
That's right. That's right.
That's not happening online. That's not happening in Zoom meetings. We're going to hang up in just a few minutes. And when we all hang up, we're okay, see you, have a great night. We might not chat again for a while, right? But if we were all in the same session at HealthCon or regional or one of our retreats or a chapter meeting, there's conversation that happens in the parking lot, that happens in
Or
the
networking, Beth. What about networking?
absolutely.
I mean, I've had situations where people say, "Hey, I need some. Are you any good with telehealth? Are you help? My physicians don't answer the queries." Okay, well, that's probably 90% of the physicians, right, Beth? They just don't answer the queries.
Yeah.
So you can say, "Okay, why don't we do?" Then it gave me an idea. Let me do a presentation on how to engage physicians in outside of coding. What's in it for them, with them, the radio station with them? Or how do you approach physicians who don't want to speak, don't answer queries, or don't want to talk to you? Okay, how do you break the ice and win their trust and respect? I've had so many presentations that I've come up with people saying, "Hey, could you help me with this?" Or "What are your thoughts on this?" That wouldn't have happened with a presentation.
Yes.
All right, so let's kind of wrap up a little bit here. So the last thing is there's a lot of information out there.
Right?
What are some sources and some red flags for information that might not be 100% reliable? Because it's out there. I'm sad to say there's information that is not 100%
Okay.
correct.
Let me start, Beth, and I'll turn it right over to you. I, I, when I was on the provider side, okay, and people would come in and do audits or do presentations or say you're not coding something right or you use the wrong modifier. I always ask for citation. I don't. Your opinion. There are some areas where maybe their experience. I'd go with their experience and say, "This is what we saw. We saw some denials coded this way." Okay, but I always ask, "Show me your material. What's your source document? Is this an opinion? And if it's an opinion, where did it come from? How did you come up with it?" I learned quite in no uncertain terms quickly that when people come in and give their opinion, it may not be the right thing.
Right.
I don't want opinions. I want the source document to say, okay, this is my rationale, and to this day, that's what I do. If I say this is what I would do, here's where I came from. If they want to do it differently and code it differently, that's more power to them. But I want the client to know I'm not pulling this from thin air. This is where I find it. This is what I'm seeing in the industry based on documentation from different Macs, okay, or OIG chart reviews, hospital reviews. Beth, your thoughts?
I, it's kind of the same. It's trust but verify. I trust you, Glenn, but let me see your citations. Let me see your resources. And maybe we can't find an LCD and NCD, but we can look back at previous EOBs or ERAs to show how the payer is processing certain claims or how they're wanting certain things to be coded. I think it just goes back to making sure that your source is trustworthy. There's a lot of, I'm going to say there's a lot of coding schools. There's a lot of people who try to teach coding who maybe shouldn't. But
That's a polite way of putting it, Beth. That's a politically correct way of saying it.
well, I don't
I
want.
would say something else, but I wouldn't because I'm on the show with you. But if I
Right.
was talking to you with not being recorded for
There's
quality
you and
assurance
me,
purposes,
right? Yeah, there's, I, kind of going back to something you said very early on in the show, is that some people are just good test takers. So can they take a test? Are they, first of all, are they even certified to be an instructor? And are they certified to be an instructor in that particular subject? I'm a CPCI. I tested way back when, um, 10 years ago or more, when you had to take the test, and now I can, any credential I have, I can teach. Okay. But now it's, if you're a CPB, you can take the CPBI, so you can teach the CPB, which is great. But teaching the CPB, I feel like you still have to have that foundation of knowing coding in order to teach the billing. And so just because they can, what is it? Those who can do and those who can't teach. And I kind of say that tongue in cheek because I do both. But I just, got to verify. And some people um, are doing it because they think they're going to make a fast buck. I would check their sources, check their credentials. Are they really instructors? Are they really supposed to be teaching coding or billing or auditing or
Or
compliance?
have they been done, like I see a lot of people teaching CDI, and you look at their credentials, they may have it, but they've only been a CCDS or a CDIP for a year, or they haven't even done it. They passed
Right.
the exam. Well, of course, for CCDS, you have to have 2 years of valid, verifiable experience. But even so, I don't think 2 years is enough to teach CDI, because the first year is basically getting their feet wet, and the second year is building upon what they learned the first year. How could you be sitting there teaching CDI
Right.
when you don't understand medical necessity, standards of documentation? Only thing they know is CCs and MCCs and hacks and PSIs and core measures. Very important, but if you don't understand the record as a communication tool, who cares what diagnosis
Right.
you pick up? You're not getting paid. Who cares?
Who cares? Doesn't matter. If there's no money coming in, the cash is stopped. It doesn't matter.
Yeah, and then we got this thing with Change Healthcare. So really,
Oh,
uh, really, you have to get the coding right, because when it finally goes out the door, you need the cash. You don't need
quickly.
denials. You don't need denials. John, this has been fun.
Oh, thank you. Well, I think that's about it for tonight. So let's give everybody that's on here a chance to talk about their company. Let's start with Beth. Let's give her a chance to talk about her advanced coding services.
So we are Advanced Coding Services. So we're here in Central Phoenix, Arizona. We have a full classroom where we teach on site, but we also do virtual. But then we also offer, so I like to think of it as I teach you how to have a career, your coding, your billing, whatever.
Right?
Um, but then I don't just leave you, because some of our students, I mean, we talked about CEUs, but some of our people flounder. They don't know they're supposed to get CEUs or where to get them. And so we offer a membership. It's called the Apple Orchard, because
Oh
our
yeah, I remember that. Yeah, that's one way you had the apple there. But
that's our Apple Orchard.
there's no apple orchards. Used to be orange orchards in Phoenix.
Well, so I'm from upstate New York, but if you think about it, the Big Apple, and you talk about education. That you think of an apple when you think of education, and so we have the Apple Orchard where we have every Wednesday we have a webinar where we talk. They're planned. And I think this week, Pam Vanderbilt is speaking about something about role or team playing in the revenue cycle management. And the week after is Sonal Patel, and she's going to talk about the OIG work plan. And so it's intentional education. It's intended to help the professional grow, not just earn CEUs, but to help you grow.
That's right.
But then we also do our retreats. And this year we have our retreats in Georgia, Boston, San Diego, Phoenix, and Hudson Valley, New York. And this is really intentional, where we all get together. Think of HealthCon, but on a much, much smaller scale.
More personal.
Exactly. It's more personal. And the intent is that, we can have those conversations, and after class, I can walk away and I could sit at the table with Sonal Patel and John Pisowski and Glenn Cross, and I can say, oh, did I get it? Did I get it? And I can say, hey, I had lunch with those people and I got to pick their brain. And now I know I got my questions answered. Because, when you go to those big conferences, and there's nothing wrong with the big conferences.
No.
I'm just saying, when you go to the big conferences, I might leave your class, Glenn, but I still have questions I couldn't get answered because there was 100 people in there. Well, our retreats are limited to 100 people. So the intent is that when you leave our retreat, first of all, you're going to feel refreshed. You're going to hang out with friends. And now suddenly you know all these people that you didn't know before, and you got your questions answered, and you have grown professionally and personally.
All right. How about you, Mr. Krause? Let's talk about your.
Okay, well, I founded Core CDI back in 2018, and I call it Core CDI because I think certainly CDI has gone and continues to have moved down, I think, the wrong rabbit hole, if you will, and focusing on the diagnosis. And I want people to think of the record, get back to the core of the medical record. It's a communication tool, first and foremost. There's a patient in there, and I work I also co-founder of Top Gun Audit School. That's topgunauditschool.com, and we have it's a fee-based, but it's not much, like what, $15 a month or something, or $129 for the year. And we do a webinar. We have like 22 webinars on the site, and it's a nonprofit, so we're not trying to get rich. And I do that with Ernie and some of my colleagues. And with my firm, we do inpatient and outpatient CDI and medical necessity reviews. And right now, we're actually working charge master reviews, observation reviews. And right now, I'm working with about 5 physicians who are practicing hospitalists. One's a medical director for a Medicare administrative contractor, which brings an interesting perspective. And we're actually doing physician education, beginning with the ED, hospitalists, surgeons, because if you really think about CDI improvement, it's not just a diagnosis, it's really the revenue cycle from the time the patient presents, right, to the ED until the prompt of discharge. So every provider, including case managers and UR people and social workers, they all have a hand in improving documentation, because they have a unique perspective, but they're still relying on the same chart, right? It's just like, okay, if I'm just coding E&Ms for the doctor's office, well, I'm not necessarily looking for the hospitalist. I'm not necessarily looking at the documentation from the standpoint of communication and the patient getting the best possible care. So everyone has a unique perspective, and that's really what you call CDI. It's taking the medical record as a communication tool, respecting it, understanding that the record serves the patient and the physicians and all the ancillary care providers, case management, coding, denials and appeals, discharge planning. So that's kind of a little bit about my company.
All right. Well, all of the presenters that I have on my podcast usually do have their own output, and I'd like to thank Mr. Glenn Krause and Miss Beth Sleeper, as well as the missing Sona Patel, for coming out today. And again, always tune in. We always have great content with people, and people I have on are known experts in the field, and they do produce their own content. So any of the previous episodes, if you want to learn more about some of those, every one of the panelists has a website or is active in giving education. And that's
I forgot to mention, John, I do have a YouTube channel, so check it out.
Okay. What is the YouTube channel name?
Core-CDI. If you put that in YouTube, it should come up.
All right, cool.
Or just put my name in there. We have about 20 different podcasts, and some of them are physicians. They're really good. I'm biased because I did them. Right, Beth? If you do them, you have a different perspective, you know?
Well, if you did them, they better be good. But really quick, I have a question, and this is completely off topic. But before we started, Glenn, they said that you were coming in from Vermont. Where are you in Vermont?
Well, I'm actually living in Maine right now, but I was living in Newport, Vermont, which is about 5 miles from the Canadian border in the Northeast Kingdom.
Yes.
But I got homesick. I grew up in Maine, so I moved back. People are like, but speaking of Phoenix, I'm going to be there probably in a week or two, because I'm going to be visiting my parents when my father's turning 90. So
oh, well, happy birthday! Listen, Glenn, if you get to Phoenix, I would love. We could go to lunch or something.
Oh, that's a good idea. Yeah, because they live in Scottsdale, so I haven't seen them in a year. So I figured I'll be the good son and see them. Right? You never know.
Well,
who knows about tomorrow, right?
Exactly. I'm about 3 or 4 miles north of Sky Harbor Airport. So when you fly in, you'll fly right over my office.
I'll wave to you, okay?
Wave to me. But yeah, I'd love to have lunch and we can get together.
John, thank you very much. This has been been quite fun. And hey, will this be on your channel, or how do we promote this for you?
I'm found on LinkedIn, or I have my own YouTube channel as well. There is a website, however horrible it is, it's quite underdeveloped, but I do have a website, Differential Coding Services. Let me just bring up my banner. And
once you publish it, I like everyone. This has been great content.
Yeah. It's on our YouTube channel. I usually post them on my website, and I also have them on here on LinkedIn I think they're all.
And so if I go to your website or I go to YouTube, I can type your name and it should come up.
Yeah. If you type in differential coating services on YouTube, it'll come up as well.
Okay. Thanks so much, Beth. It's been real.
It's been very nice. It's nice to chat with both of you. It's been an honor. You guys have a great rest of your night.
Yeah. Thank you. Take care. Bye bye.
Bye bye.